So question number 4, COVID and the 15%. So I actually was on the news last week locally about what is going to happen whenever we've had a week long of COVID-19, and if 15% of the population or the hospital population has COVID-19. So we hit that mark recently, and what that means basically is that if you've had Governor Abbott here in Texas declared that if we had COVID-19, the population in the hospital was greater than 15% for 7 straight days for a week, there's going to be a possibility of shutting down elective cases. And in essence, that is the potential what could be happening now here in Texas, at least in Lubbock. We've had COVID-19 at a high rate for at least 7 days, and it's getting higher and higher and higher. The important thing beyond just the minimizing of the elective cases is just the prevalence of how high COVID-19 has become. So right now, as you can see, it's very cold right now. And with the cold, we're going to get more and more viruses coming on that typically come on at this time of the year. Flu, cold, RSV, things like that. When you add that to the patients who have COVID-19, and we have a very significant patient population right now in the hospital who has COVID-19, what that means is a couple of things. Number one is that those patients who routinely come to the hospital for the normal flu, pneumonias, things that occur during winter, we may not have the beds available for those patients, which means you may have to go elsewhere. Number two, if the hospital is full of COVID-19 patients, that means routine care like getting your gallbladder removed, or getting that hip surgery done, or getting that colonoscopy, or let's say you get into a car wreck and you need surgery. Those things are going to be more difficult because we don't have enough room in the hospital for those routine medical care. But also number 3, more and more people, especially healthcare workers, are going to be exposed to COVID-19. And if they're exposed, there's a chance they can get sick or even have to be quarantined as well, which depletes the healthcare sources that we have currently available. And the more healthcare people that are out of work, the less likelihood there's going to be for us to take care of you guys. And so do what you can to obviously protect yourself. If you haven't, go outside and wear a mask, wash your hands, practice social distancing, and try to help educate anyone that can be. It's okay if you don't necessarily believe what is going on. That's fine. I understand that. But I can tell you it's real, and we want to protect those of us who maybe could be exposed or at higher risk of developing complications that can occur later on, for those people who may get COVID-19 and get really, really sick from that as well.